thrombus on contrast enhanced CT scan of the thorax. You know that CT pulmonary angiography is now the gold standard for the diagnosis of pulmonary embolism. Occasionally you may be able to pick up a thrombus in transit in the right heart chambers or main pulmonary artery, but that's a very rare occurrence. Usually when pulmonary embolism is suspected, we only find evidence of dilatation of right-sided chambers and increase in pulmonary artery pressures by echocardiography being a bedside tool. This is a section from a contrast-enhanced CT of the thorax. These are the cardiac chambers. This is descending aorta, vertebra, and the rib cage. Lung is not seen well because this is not a lung window. It is a vascular. Only the contrast-enhanced regions are seen. Myocardium is seen as partially contrast-filled. What you have to concentrate is the branch of the pulmonary artery. This is descending aorta on left side. Cardiac shadow is mainly on the left side. So this is right pulmonary artery. And you can see thrombus here extending into branches as well. All these negative shadows where the contrast is not seen are the part of thrombus. So this is a case of probably venous thromboembolism with pulmonary embolism. Rarely this could also be in situ thrombosis in a pulmonary artery branch, but that is uncommon. CT pulmonary angiogram is quite sensitive and as mentioned is the gold standard for the diagnosis of pulmonary embolism. In fact, if CT pulmonary angio is negative, you can almost safely rule out pulmonary embolism. But there is a caveat. Occasionally, a recent thrombus can fragment, get dissolved, and go into the periphery so that it may not be seen like this. So that's a small caveat. But routinely, if in a suspected case of pulmonary embolism, if CT pulmonary angio is normal, you take it as there is no pulmonary embolism. The older tests of ventilation perfusion scan are rarely done. So also contrast angiography, that is invasive pulmonary angiography is also seldom done unless you are planning some interventions like pulmonary balloon angioplasty in some cases of chronic thromboembolic pulmonary hypertension. Otherwise, the gold standard which is routinely done is CT pulmonary angiogram. At the bedside, you may do an echocardiogram to assess right ventricular and right atrial sizes as well as the pulmonary artery pressures, especially since CT takes time to arrange.